So, a forensic pathologist is a trained physician who can determine the cause of death by examining a corpse. In order to do so, they may need to examine their victim's previous medical history. They may even get involved by looking for clues at their crime scene and gathering information off of their victim's body. And all that ultimately leads to them being able to perform an autopsy. Um, once this whole process is wrapped up, they will type up a report, which will state all of their findings, and if needed, they can also show up in court and just give a medical testimony on the victim and what the cause of death was. In the following image, you will see medical examiner Mandy Wilson examining a body. The body is of a 43-year-old male victim who was found in an alley. As she first came upon the body, she was able to determine that the body had been deceased for 48 hours prior to it being found. Now, back in her office, she has determined that there are no indications of gunshot or stab wounds. So she will now continue to do further examination to be able to determine the cause of the death. Forensic nurses are basically registered nurses, with the exception that they have this training to identify signs of neglect and assault in different victims. Aside from that, they can also provide medical testimonies in court, since they do have a very specialized type of understanding of the legal court systems. So in the following image, you will see Nurse King interviewing Nancy, a 23-year-old victim who has been suspected of being sexually assaulted. After running several tests, he has indeed confirmed that she was sexually assaulted, and he is now taking her statements of the events leading up to the incident. Once this statement is finished, he may or may not be called up to court and be asked to give a medical testimony of the victim's allegations. So, registered nurses provide patient care. With that care comes anything from educating their patients on their health conditions to informing the public about current health conditions going on in their areas, and just emotionally supporting their patients and their patients' families, and whatever it is that they are going through at that moment. In the following image, you will see Nurse O'Neill consulting with her 63-year-old female patient named Pam. She is informing Pam that after 2 years of aggressive cancer treatment, she is officially cancer-free. As previously stated before, O'Neill's job as a registered nurse is to be there emotionally for her patient and her patient's family. So after providing such exciting news, she is being a support system for Pam